Diabetes is one of the major health problems around the world. Diabetes affects about 382 million of the world population and about 35 million patients in the Middle East region alone. That's according to 2013 statistics. There are two types of this metabolic syndrome. Type 1 is because of inability to produce insulin by the pancreas, and type 2 is due to lack of sensitivity in insulin receptors across the human body. Type 1 diabetes mellitus usually strikes at young age, and it is the toughest one to handle or to manage. Most common causes are hereditary genetics or autoimmune destruction of beta cells of pancreas. Type 2 diabetes mellitus is most probably due to overweight and obesity. As the fatty tissue overgrows, the insulin receptors across the body tend to lose their function, their shape, and their ability to respond to insulin. Diabetes mellitus can lead to nephropathy and renal failure, atherosclerosis and cardiovascular complications, retinopathy of the eye, poor wound healing, and diabetic foot gangrenes. The drug of choice for treating diabetes mellitus is insulin. Unfortunately, insulin is mainly given by subcutaneous injections, which is painful for the patients and can lead to lipotrophy at the site of injection. Oral delivery of insulin can enhance the patient acceptability and reduce the side effects such as pain and lipotrophy at the site of injection through to the control of release of oral insulin. The problem with insulin is that it is degraded in the stomach, same as any other macroprotein molecule. This is what makes the subcutaneous injection is the most effective route for the delivery of insulin. The design of our oral delivery depends on placing the insulin on chitosan nanocarriers and place the nanocarriers inside an osmotic pump with a single oral. The oral insulin of the osmotic pump is an elementary type of osmotic pump. The osmotic has a mucoadhesive site, and the whole pump is placed in a pH sensitive matrix targeting the human colon. This design is based on chitosan delivery system. Chitosan serves as both mucoadhesive polymer for the pump and nanocarrier for the insulin to be delivered to the tissue. The osmotic agent of choice is potassium chloride, and the pH sensitive matrix consists of xanthine gum matrix, which has proven high efficiency in delivering medicines to the colons before. The proposed design is aiming to enhance the bioavailability by 35 to 55%, and the osmotic pump can emit the full dose within 3 hours, so the insulin would take 8 hours to be effective.
Created using Powtoon.